Hi, everyone. So I had a team, myself and two other people. We trained on that same pit crew technique that you just saw from Christchurch, New Zealand. And then we recorded ourselves doing pit crew CPR following that model. So what we're going to do in this video is basically watch a video of that going down, and we're going to break down everything in that video kind of step by step. So hang with me here while I share my screen. Share the sound so you can also hear the same video. So first, I want to thank Matt and Natasha for starring in this film. They showed up and I unexpectedly threw them into being filmed doing pit crew CPR after just training on it. So the start of pit crew CPR in this case, what is where all the business kind of happens. Once we get going, it's kind of boring and there's not a whole lot going on. So this first part, we're going to watch a few times. So we're going to watch it this first time here. I'm not going to say anything. And then we'll back up, watch it again, and kind of break down every step, piece by piece, and look at everything that's going on in this video. So let's just watch the beginning here to start.
PPE is on. The scene is safe. I don't see any major bleeding. Hey, are you okay? No response. Shoulder pinch, no response. Get the AED and call for ALS. I'm going to check pulse and breathing. No pulse, no breathing. Starting CPR.
Starting on an AED.
10.
Apply pads.
15.
I'm going to place the pads around you.
20.
Nothing in the airway.
25, 26, 27, 28, 29, 30.
All right, analyzing patients. Don't touch.
Okay, so the first few steps there's a whole lot going on. So we're going to go back and recap this. We're going to go through it 3 more times. We're going to first watch what position 1 does here. That's me in the blue shirt. Then we're going to watch what position 2 does. That's Natasha here in the hoodie and the black hat. And then we'll go through it a 3rd time and watch what Matt does in the 3rd position. That's here on the airway. So let's go back.
PPE is on. The scene is
So you hear Danielle coming on scene, position 1, PPE, scene is safe. Every rescuer really should be doing that, but since I was first on, I figured I would emphasize that.
safe. I don't see any major bleeding. Hey, are you okay?
So we have position 1, assessing the patient to determine if CPR is needed.
No response. Shoulder pinch, no response. Get the AED and call for ALS. I'm going to check pulse and breathing.
Okay, so they've called for ALS, they've called for the AED. Position 1 is checking pulse and breathing to determine if CPR is needed. As you can see, person 2 just came on scene, and very soon you're going to see position 3 coming on scene.
No pulse, no breathing. Starting CPR.
Okay, so now if you watch person 1 for the remainder of this start, all they're doing is chest compressions. They're doing those chest compressions. They're really not doing anything else. Ideally, this person is also kind of watching the other people part of working as a team is watching what everyone else is doing as well, having your primary focus on your role, but also looking around you. So if you see anything wrong, you're also correcting that information.
10.
Those compressions are being counted out loud. Every single compression can get kind of distracting, but you'll hear 10, sometimes 15, you'll hear 20, and then you'll hear 25, 26, 27, 28, 29, 30 to let the other people on the team know, okay, the breaths are about to happen.
15.
I'm going to place the pads around you.
20.
Nothing in the airway.
Again, those chest compressions are continuing as the pads are being applied around the compressor.
25, 26, 27, 28, 29, 30.
Now here you see position 1, I did reach over and squeeze the BVM bag. And, that was a little bit out of the role because you'll see when position 1 is doing the chest compressions, position 2 is supposed to be squeezing the bag. But as you can see in this still frame right here, position 2 is very busy with the AED at the moment. So this is part of teamwork. You pick up the slack where things aren't happening. Everybody has their role. At this moment, the AED is the most important thing. It could have been myself reaching over to squeeze the bag, or it could have been Matt recognizing, hey, I'm going to have to do 1 rescuer's BVM for this first round of breaths. And he could have used 1 hand on the mask and 1 hand on the bag. But I saw that he had 2 hands on the mask. I reached over and squeezed the bag, allowing the AED person to focus on her most important role at the moment, which is using that AED.
All right, analyzing patients. Don't touch.
Okay, and that's kind of the end of what position 1 is doing for the start of this scenario. So let's go back through, let's walk through it, and let's look at position 2. So this next time, we're going to focus on Natasha here on the patient's left and what she's doing throughout the scenario. So remember, position 2, their goal is to show up, and they're mostly in charge of operating that AED. So let's look and see what all she's doing.
The scene is safe. I don't see any major bleeding. Hey, are you okay? No response. Shoulder pinch, no response. Get the AED and call for ALS and then check pulse and breathing.
So again, she's the second person on scene, making her position 2. Also, she's going to the patient's left, which also makes her position 2. She is carrying the medical bag so that she and the airway person will have the supplies they need.
No pulse, no breathing, starting.
Notice that she doesn't take any hesitation. She goes straight to that bag looking for her AED. That's all she needs at the moment. She's just going to go straight to the AED.
CPR.
Turning on AED.
Again, turning on that AED first. That's one of the key tenets of high quality CPR. Always turn your AED on first. It's going to talk you through the steps. You're also going to make sure that it actually does turn on. Actually, a little funny side story. We started to run through this the first time. The first AED I grabbed, these are all trainers, but the battery was actually dead. So I was like, well, that's a good thing to learn before we start recording. Make sure that your AED does have good batteries. But turn it on first, make sure it's going to turn on. Let's continue.
10. 15.
I'm going to place the pads around you.
20.
So you see that she lets the compressor continue with compressions, and she's communicating with the team to let the compressor know, I'm going to work around you, and she's applying those AED pads.
Nothing in the airway.
25, 26, 27, 28.
Now, one thing I noticed here
20.
is that this lower left pad is slightly up onto the abdomen where maybe it should have been down a little bit more onto the rib cage. You'll see way later in this, I'll come back and correct that. But as soon as you notice something's incorrect, it should be corrected, whether you're the person, whether she's the person applying the pad notices it or somebody else on the team. You can either verbalize that or correct it yourself. The best thing is probably just to verbalize it. But at this time, I was busy counting impressions. I didn't notice it. Matt maybe didn't see it either, or maybe it was a miscommunication. But we're going to keep going here with that, focusing on that position 2.
9, 30.
Breaths happen.
Patients, don't touch.
Okay, notice that as soon as the AED says analyzing, we have position 2 repeating that information to the rest of the team. Everyone else on the team is busy with focusing on their role. So this person's role is repeat that information to everybody else. Hey, stand clear so we can get this AED analyzing.
I can take over the AED for you.
So there we have person 1 kind of thinking ahead. It's like, okay, position 2 is going to take over chest compressions as soon as the shock is delivered. So it makes more sense to pass over the AED so that shock can be delivered by position 1 so that position 2 can take over chest compressions. There's this long period of time where we're not doing anything anyways.
Turning on the oxygen, setting to 15 liters per minute.
Shock advised. Charging.
Okay, at this moment, you heard it say shock advised charging. I know if you train with your own department, you might start doing chest compressions right here in this moment to you can get about 15 extra compressions in while the AED is charging. As I mentioned earlier, you have to be really careful and know your equipment. There are some AEDs where if you do those chest compressions right now while it's charging, it'll disarm itself and will not deliver the shock. So if you know your equipment, and you know it's okay to do those compressions right now, dive in, get as many compressions in as you can before you're ready to shock. If you are using equipment that you're not familiar with, say you're using an AED that you found in public, just follow the prompts. You'll notice this AED does not tell us to continue compressions at this time, so we're not going to do the compressions. We're not going to risk it.
Stay clear of patient.
Everybody stay clear.
Okay, now that position 1's running the AED, notice they're repeating the prompts. Stay clear, all clear. Position 2 is getting ready to do those chest compressions.
Ready to do compressions, hover over the chest, all clear.
So a little bit of a possible miscommunication here. Position 1 tells position 2, hey, hover over the chest. I'll give you a little bit of a backstory. Position 1 does have a knee injury going on here, so it's difficult for her to hover over the chest. So in a perfect scenario, position 2 would be hovering about an inch over the chest, ready to start those chest compressions. But you'll see here there was a little bit of miscommunication. She actually touched the patient The person operating the AED is going to make sure that she's clear. And then you'll see that she kind of backs up because she can't really hover with that injury going on. So we'll kind of see how that goes.
All clear.
Shock.
Shock.
Delivery.
Continue CPR.
Measuring
Okay.
for OPA.
So there we have. Now,
CPR.
person 2 is taking over those chest compressions.
Starting the
And
OPA.
we'll come back, you know, let me pause this. Position 2 will have some other roles later in the scenario, but right now they're just going to go into those chest compressions. They're going to be doing their 30 chest compressions, counting out loud as position 1 did. So we'll watch through that part.
20, 26, 27, 28, 29, 30.
Breath. Breath.
And there you see position 1 taking over that BVM. So that's position 2. Now we're going to walk through this whole thing again. This time we're going to focus our attention on Matt in the back, who's in the airway. He's position 3. So let's start over and have a look at him.
I don't see
So
any major
position 1 on
bleeding.
scene.
Hey, are you okay?
We're not really going to worry
No
about what she's
response.
doing.
Shoulder pinch, no response. Get the AED and call for ALS. I'm going to check pulse and breathing.
We have position 2 on scene. We're not worried about her. Okay, now we have position 3 arriving on scene. Watch him dive right into the airway. So let's listen closely to what he's doing.
Pulse, no breathing, starting CPR.
Okay, you notice he's going for the med bag or the airway bag. Let's see what he gets out first.
Starting on AED.
So you see he grabbed that BVM first. BVM, that's going to be the thing he needs first, so he grabs that right away.
10.
Apply
He hears that he hears that the compressor's at 15, so he knows we're halfway to that first breath.
I'm going to place the pads around you.
20.
Nothing in the airway.
He did have time to check the airway, so he looked in the airway to visualize and see if there was anything that it might need suctioning.
Flashing light.
25, 26, 27.
He hears me counting down those last 5 compressions. Notice he's getting that mask in position, getting ready to give those breaths.
28, 29, 30.
All right, analyzing patients. Don't touch.
Okay. He follows the prompts of the person running the AED to stand clear, and he's going to use this time to get the rest of his equipment ready. All he has out is the BVM we talked about earlier. He's going to need the other airway devices.
I can take over the AED for you.
So I know it's hard to see. Position 2 is blocking a little bit, but you'll hear the rattling of the metal. He's right now assembling the oxygen tank.
Patient.
Turning on the oxygen, setting to 15 liters per minute.
Notice he verbalizes that to let the rest of the team know, hey, I've got oxygen flowing 15 liters a minute. So if we're keeping tabs on that, or if we have a leader, they know, okay, oxygen's on its way.
Shock advised.
He's connecting the tubing from the tank to the BVM.
Charging.
These are all great things to do while the AED's analyzing and charging, because none of it requires touching the patient. So he's getting all this done during that analyze cycle.
Stay clear of patient.
Everybody stay clear.
He's currently digging in the bag for the OPA so he can get ready to measure that OPA as soon as he has the clear to touch the patient. He knows he'll have 30 compressions to get that OPA measured and inserted.
Deliver
Ready for
shock.
compressions, hover over the chest. All clear, all clear.
Shock.
Shock.
Delivery.
Continue CPR.
Measuring for
Begin
OPA.
CPR.
Inserting the OPA.
10.
So he measures and inserts the OPA. He did trick you there. That was fake because this mannequin doesn't really have a mouth, but he's measuring and inserting the OPA.
OPA's in.
And he gets right back into position to give those breaths.
20,
Knowing he has 10 breaths to go,
26, 27, 28, 29, 30.
Breath. Breath.
and that's pretty much the extent of the role of position 3. So I'm going to let you watch it all one more time and keep my mouth shut so you can watch through everybody's roles and how they all work together fluidly for this setup. And then we'll watch a few more cycles and pause a few places to see different things that take place throughout the scenario.
PE is on. The scene is safe. I don't see any major bleeding. Hey, are you okay? No response. Shoulder pinch, no response. Get the AED and call for ALS. I'm going to check pulse and breathing. No pulse, no breathing. Starting CPR.
Starting on AED.
10,
Apply pads.
15.
Patient's
I'm going to place the pads around you.
Plug
20.
in pads.
Nothing in the airway.
To flashing light.
25, 26, 27, 28, 29, 30.
All right, analyzing patients. Don't touch.
I can take over the AED for you.
Patient.
Turning on the oxygen, setting to 15 liters per minute.
Shock advised. Charging. Delivery.
Continue CPR.
Measuring for
Begin
OPA.
CPR.
Inserting the OPA.
10,
OPA's in.
20, 26, 27, 28, 29, 30.
Breath. Breath. Checking for compression effectiveness. I can.
So there we have position one, not doing compression, so they're squeezing the bag for those breaths, but also taking this opportunity to feel for that carotid pulse and make sure that position two is doing effective compressions.
Feel the pulse. The compressions are effective. Keep going.
20, 27, 28, 29, 30.
Breath. Breath.
10,
All the beeping noise that you're hearing, the mannequin actually beeps when you do compressions, but also the AED itself is beeping to tell you the rhythm for the compressions. That's kind of like your metronome. It's kind of hard to do with this mannequin also beeping. So you'll notice that she's a little bit faster than the AED, but that's actually fine because I think this AED, it seems to be right at that 100 speed. So you can go a little faster to get up to that 120 speed. I think she's going at a great speed here, but if you notice all that different beeping, that's what's going on. You do always want to keep that AED on because remember, it's going to time that 2 minutes for you. It's also going to have that metronome because, you know, real patients don't beep when you compress their chest. So it'll be a lot easier to follow that beep when you don't have the second beep of the mannequin going at the same time.
20, 25, 26, 27, 28, 29, 30.
Breath. Breath.
Position one could have done a little better there at having hands on that bag before we got to 30. When you hear that 27, 28, you should have your hands on the bag ready to go. I was kind of sleeping on the job there.
A little slower.
Now you hear position one saying a little bit slower. So they noticed that the compressions were getting a little bit too fast. So they're telling position two, slow down a little bit on your compressions. You always want to speak up as soon as you notice that something's going wrong.
16, 17, 19, 20, 24, 25, 26, 27, 28, 29, 30.
Breath. Breath.
10, 17, 20, 24, 25, 26, 27, 28, 29, 30.
Breath. Breath.
Notice every time when those breaths are given, as soon as the compressions stop, the two breaths come in. And as soon as those two breaths are completed, she's right back on the chest. So there's no extra gap in time between those compressions and breaths as we swap back and forth between 30 compressions and 2 breaths each time.
10, 20, 4, 25, 26, 27, 28, 29, 30.
Breath. Breath. Compressions are still effective. I can feel that carotid pulse. Keep going.
Noticing a little fatigue in position 2, so checking the pulse to make sure those compressions are effective.
25, 26, 27, 28, 29, 30.
Breath. Breath.
Analyzing.
All clear. Analyzing heart rhythm.
So again, position 1 is now in charge of that AED. So as soon as it chimed on and said, stand clear, notice position 1 repeats those instructions to the rest of the team. So everybody knows to stand clear. The compressor now stands back. The ventilator now removes the BVM from the face, so nobody's touching the patient.
I'll let you deliver the shock and I'll take over compressions.
The patient.
Communication between the team that we're passing the AED. Here you see position 1.
No shock advised.
There you saw position 1 hovering over the chest. So as soon as that shock is delivered or no shock advised, those compressions continue immediately.
If needed, begin
10.
CPR.
20, 25, 26, 27, 28, 29, 30.
Checking compressions. They are
10.
effective.
There you have position 2 checking the effectiveness of compressions because position 1 just took over. So just making sure we're still feeling that carotid pulse during the compressions.
15, 20, 25, 26, 27, 28, 29, 30.
You see position 2 getting hands on the BVM, ready to give those breaths as soon as they hear me count down those last 5 compressions.
10, 15, 20, 25, 26, 27, 28, 29, 30.
And again, hovering over the chest for those breaths to be let in, but ready to jump right back into those compressions.
15,
Limiting that amount of time between compressions and breaths.
20, 25, 26, 27, 28, 29, 30. 10, 15, 20, 26, 27, 28, 29, 30.
Again, you can hear those compressions are faster than the beeping of the AED, but that AED is right at that 100 mark, so going a little faster.
15, 22, 23, 24, 25, 26, 27, 28, 29, 30.
There's one more transition in here. We're going to stick around and watch, and then
15,
the video will cut off. But I want to see that switch one more time between those compressions and the AED use.
25, 26, 27, 28, 29, 30. 10.
Analyzing
All right,
fire
double touch patient.
All clear.
Again, notice that time. Position 2 is now in charge of the AED, so when it chimes in, she repeats those instructions. Everybody stand clear. Now you hear the communication between the team members. I'll take over the AED. It's being passed across to position 1 to take over that AED at this point.
touch the patient. Shock advised.
Hover, get ready to start compressions. The hover, don't touch.
Charging.
Hover, don't touch.
Stay clear of patient.
Everybody stay clear.
Deliver shock.
All clear, shocking.
Shock delivery.
Continue CPR.
If needed, begin CPR.
10,
Compressions are effective. Keep going. I can feel the pulse.
Again, we started again with somebody new, so we're checking the compression effectiveness to make sure those compressions are good.
26, 27, 28, 29, 30. 15, 20.
Okay, I noticed that pad was out of place. She's busy doing compressions. I had time while I wait for that 30th compression, so I went ahead and replaced that AED pad to make sure it was in the best position possible.
PE is on. The scene is
Good.
safe.
And that's the whole video. So that's how you do pit crew CPR. That's an example. We had to practice. It took us a couple takes. We made a couple mistakes, but as a team, we worked together and learned how to do that. So hopefully, if you are on a crew, you can practice with your team and come up with something. Again, it does not have to be exactly like this scenario. You don't have to do it exactly with this method. You can use, you can have 4 people, you can have 3 people. You might have to adapt your model based on how many people you have working with you at the time. But as far as, who does breaths and who squeezes the bag and all that kind of stuff, totally up to your department. And the most important thing is just that you practice it the same way every time. So when you show up, everybody knows their role, they jump into position. And when all else fails, just make sure that high quality chest compressions are always going on. If everyone else around you is confused and not doing anything, jump in and do those chest compressions, and the rest of it will all hopefully come together. But those chest compressions are definitely the most important part. So we're going to come back with another video and recap some other things that have happened in setting this up. And we'll talk a little bit more about things that can go well or things that can go wrong. So I'll see you all in the next video. Thanks.